Massachusetts has very, very expensive insurance because it is a very expensive mandate. So this can be done at the federal level. There will be lobbying against it because the insurance companies don't like the fact that, you know, you might be getting at Empire, you might be getting you know, $1,000 a month in premium from you, and then you, a young lady, decides to go to Idaho and buy your insurance for $100 a month, and so that creates distortions that they don't like.
Along with that, what can be done about all these mandates? Can the federal government, you know, equalize mandates, or how can that be?
Well, I think the individual states have to reduce state mandates, and you know, we try to make people aware. I mean, if I want an insurance plan that has in vitro fertilization, and the plan is out there, I should be able to buy it. But, you know, why should Richard Gino have to buy an insurance plan with in vitro fertilization when he's probably not going to get pregnant? And why should he have to subsidize? Why should he have to subsidize the kind of insurance that I want? So, you know, people have to realize that every single organization is up in Sacramento or, you know, in Albany, New York, saying, I represent the Chiropractors Association, I represent the Autism Association, and they lobby and they get these things added, but it means everybody has to share in the cost.
First, I'd like to ask about the constitutionality of it, of the health care bill, and then if it does get passed, can it be reversed?
Right, and I talked a bit about that in my remarks. You know, there have been a lot of scholars and lawyers have said that if it does pass, it will not stand up to scrutiny and be unconstitutional. And I think that's probably true. One of the issues that I worry about, though, is, and my husband's a constitutional expert, so I did steal this from him, that if the bill passes and it's challenged and it goes to the Supreme Court, we cannot always rely on the decision of a court, because if the court could well rule that because Congress, representing the people, passed this, why should we reverse it? And so if that were the case, and if it went to the court and it did not pass and it was stood as constitutionally sound, it would be much more difficult, I believe, for us, for a challenge to repeal the legislation. So I think it's fine, but I just want people to be aware that, you know, it could make repeal more difficult, a challenge that's lost in the Supreme Court.
When we talk about pre-existing conditions and the insurance companies having to take everybody on board, the moral factor kind of comes up. You know, I'm not going to buy insurance until I need it, right? So when something comes up, then I'm going to buy insurance. How do you get around that? It's one question, and another one is, you know, if you compare, if you're looking at insurance and you're talking about automobile insurance and you've had a few DUIs, your insurance premium is going to be way up here because your risk is higher.
Right.
When I look at health insurance, I would think the same thing needs to occur. I think your pool approach was probably the answer to that.
Right. Guaranteed issue and community rating, which you know, under the Senate bill, the OPM, the Office of Personnel Management, the part of the federal government that runs the federal employees' health benefit plan, would be put in charge of what is an adequate benefit package. So that in itself is the government determining what is the appropriate benefit package is very important. Plus the fact that they said insurance companies would probably have to spend 90% of the premiums they collect on claims. So this is not going to be an incentive for new people to go into the insurance business or for smaller insurance companies to even stay in business. The president, because he wants guaranteed issue and community rating, you're right, only people will only buy insurance when they find out they have an illness, and then when they're better, they will drop it. So this is going to add tremendously to the cost of those people who have insurance. And second, therefore, you have to tie that to an individual mandate. And so that everybody has to have insurance. And that is a very bad thing. In Massachusetts, we've seen the individual mandate, you know, has led to increased premiums. There's still 2% people uninsured. People pay the fines, and there are fines within the Senate bill and the House bill, but they're low. And it wouldn't be an incentive for people to buy insurance if they don't want to.
Excuse me, Richard, how many more minutes do we have here for questions? Okay, we'll continue.
First of all, thank you for your hard work on this. And as a licensed attorney, I'm going to second your husband and you. You can't depend on the courts. We can't let it get that far. They're very unpredictable. You never know what they're going to decide. So don't let healthcare get that far. My name is Kevin Gordon. I'm running for the United States Congress in the 15th District against my Congress. There's a particular interest in this. And I want to know what your thoughts about the McCarran antitrust exemption for insurers. Do you think that should be repealed?
The which?
The antitrust exemption that insurers have.
Right, yes, I don't think it's a good idea, but I haven't really thought, that's one thing I haven't thought that much about, because I didn't think it was that important, but it is out there. I don't think it should be repealed, but I haven't done a thorough investigation, so I can't comment.
You just said that you are for competition.
Pardon me?
You just said before that you are all for competition in the
Yes.
field. And if you don't have an antitrust, you don't have a competition.
Mm.
So it should be repealed to allow competition.
Thank you.
Thank you.
My question relates to sort of the culture that has developed here in this country. We talk about a healthcare system, but it's really a marketplace, whether we like it or not. So how do we get back to the point where we're talking about the market, producers, doctors and nurses and hospitals, and consumers, which are the patients? How do we get back? I think over the last 40 years, we've developed this idea that it's a right and it's a system.
Right. And as you said in the beginning, we're entitled to life, liberty, and the pursuit of happiness in this country. And healthcare, should not be a right. We should have access to healthcare, but how do you determine how large that right should be, and how should it be determined against other rights that we have? Should housing be a right? Should food be a right? Should clothing be a right? It's very, very difficult. So that's why I support the idea of patient-centered solutions. Using